Are you ready to learn the secret to peaceful and stress-free caregiving? I am excited today to share the top 3 caregiving mistakes that caregivers make. After 30 years of nursing, I've heard all sorts of caregivers come and talk to me about why they're exhausted, why they can no longer handle the day-to-day caregiving needs of their loved ones. And usually they're really sad about this. They're really upset and they wish that they could still handle it, but they're worn out. They are tired and they want their lives back. And when I listen to their stories over the last 10, 15, 20 years, I have realized that there are 3 things that people do that makes caregiving so difficult. For the last 10 years, I have been a full-time caregiver. I have 3 seniors that live with me full-time in my home, and they need everything from very little care because they're still walking and independent all the way through end of life. So I've seen and done a lot of care. I am involved in it in a day-to-day hands-on way. And so my mission these days is to go out there and help caregivers find the balance that I have learned to do in the last 10 years. Because I have had that experience. I've had multiple people to do it with. I've been able to refine the process. And, you know, they always say that practice makes perfect. Well, the problem that a lot of caregivers have is that they don't get a chance to make it perfect because they only have to care for one person. And by the time they get done caring for that person, they are so relieved to be done with the process, usually, that some of them even feel guilty because by the time they get towards the end, they're wishing their loved one would die because they are so exhausted at being a caregiver and they've given up everything about their own life. You know, a lot of people will say, well, I didn't get to do anything with my grandkids because I was stuck caregiving. And so then I hear the other side, that people don't want their loved one to provide care to them because they don't want to be a burden. They don't want to have their loved one, their daughter or son or whoever, give up their life in order to caregive to them. And I think that caregiving, when we go into it and think about it from a perspective of maintaining balance, that caregiving can be a rewarding and wonderful experience for both parties. I know that in the last 10 years, it has been a huge blessing for both me and my family. We have truly enjoyed being able to help people go from independent and able to do their own thing all the way through the process to most of the people that live with us stay until they die. And so what is the 3 things that caregivers need to do to bring back that sanity to the caregiving experience? And these things apply whether you're caring for your loved one in your home, their home, or whether they're in an assisted living somewhere. Because some of these things, all 3 of these things happen no matter the setting and no matter whether you are a full-time caregiver or just the part-time caregiver. So the first thing that I have to say is that we have to stop reorienting dementia patients. When I was in nursing school and as a young nursing assistant while I was working through nursing school, the thought process back then with dementia patients was that we needed to keep them oriented. So, you know, if you went in and the patient, you asked them what day it was and they said it was Friday, well, you needed to put a lot of effort into making sure that they realized that today was not Friday, today is Saturday, and we need to make sure that they know today is Saturday and that they knew what the proper year was and that they knew what my proper name was and who I was and where they lived and that their parent had died, that we needed to do all of these things to keep them oriented to the present day. And I think that, we had the right idea. We wanted the best for our patients. But what we didn't realize is that this is very frustrating to the person that has memory problems. They know at some level that they don't know the right answers. They recognize, and that will come and go throughout the day, how much they recognize that they have a problem. And there is no reason to be upsetting them every day with the fact that their mom died 10 years ago. I have a lady living with me right now who asks me frequently, when's mom going to get here? And a lot of times she will realize on her own that mom's died, but usually I just kind of defer that question and I say, oh, she's not able to come right now. And we just move on and talk about something else rather than focusing on getting her to remember that. Because every time someone with memory problems gets reoriented to the fact that their parent or their loved one has died and isn't here, that causes them a little bit of grief. And I don't think anyone wants to be constantly experiencing the fact that their loved one has died. I know that I don't want to experience that over and over and over every day, and I don't think you do either. So let's stop worrying about making sure that they know who you are or where they're at. I tend to just try to make them feel good and give them an answer that makes sense to them and let them usually answer it, and I just go along with it. So if they think that I'm a daughter or that I'm a friend or that whoever I am, we go with it. And they recognize that they know you and they recognize that they like you. And that's what you want. You want that dementia patient, you want your loved one to recognize you as a person that they enjoy being with. And that is always my goal. Instead of worrying about orientation or what the name of the place is where they are, I just bring them back to that I am their person that's taking care of them and that we're going to have a great day today. And one of the ways that I do that is a lot of times, at least with my dementia patients, they will say, I want to go home, or I think I need to get packed to go home. And instead of trying to talk them into staying, what I have found that works really great is I say, oh, you're not going to leave me, are you? I would be so sad if you leave me. I'm so happy that you live with me. And that just puts them back on a better motion. They focus more on the fact that they are where they're supposed to be because I'm happy to have them. Whether that means that they understand that they're just a temporary guest or that they live here full time, it really doesn't matter. And we have that discussion over and over again because, of course, they're going to forget. So number 2 is to stop making people do things that they don't want to do by force. I read and hear from caregivers a lot that they'll say, oh, well, I can't get my person to take a shower. And I always think, well, the way that I get people to do what I want them to do is I manipulate the environment. Instead of trying to force people to do what they don't want to do, just make the environment have a way so that they will naturally choose what you want to do. Remember, we are not dealing with kids, even though they may behave like children. They are still adults and they want to feel like they're making their choices and that they have control over their life. And so one of the things that I do, because sometimes the shower caregiver won't get here until later in the morning, I will feed people in their pajamas, or I will let them sleep in on the day that the shower person comes. And instead of getting them up, getting them in their clothes, and then have them say, I don't want to take a shower, I'm already dressed. Because I used to try that. Not for very long though, because I love manipulating environments. I love having people be happy with me. And so my thought is always, how can I change what's happening so that people will naturally choose what I want them to choose so that we can all be happy? so that I will be a good person, not the bad person. I hate being a bad person. I love it when everyone just does what I want them to do because I've fixed the environment. So how else do I do this? I do this with dementia patients a lot. A big struggle that I hear is my loved one won't go to bed. It's 10 o'clock at night and they won't go to bed. What do I do? And what I do is, number one, in the morning when they get up, I make sure that the lights are all on. I don't care what it does for my electric bill. That is just what happens in my house, is the lights are all on all day. They do not go off. They do not get dimmed. They are full and bright during the day. And then once we eat our dinner, we dim those lights. And if it's still bright outside, I close the blinds. And what am I doing? I'm manipulating the environment so that people will think that it is evening time. And when it gets even darker inside, because I've turned the lights down even further, and then I make sure everyone starts saying, "Good night, I'm going to bed." So my kids will come through the room, the living room, and they'll say, "Oh, good night, Mama, I'm going to bed." And my people that I'm taking care of, they'll hear that. And they will naturally, when the lights get dark, it's amazing, they will just say, "I think I'm tired now. I think I need to go to bed." And I say, "Oh, great." And off to bed they go. There's not a fight. There's no complaining. It just happens because they've chosen it, because they think that that is the right answer. So number 3 is that we need to stop trying to cure everything. You know, I hear from caregivers that they want to make their loved one be better. And we need to remember that older adults, we're not going to cure all of the problems from a lifetime. So if your loved one has smoked all of their life, forcing them to stop smoking and giving them a lot of medications is not going to fix the damage to their lungs. They're still going to have that. So we need to focus instead on their comfort. What can we do to make them comfortable? And sometimes that means that we need to think about the testing and the diagnostic testing and the trips to the doctor. What I like to advise the people that live with me is what is going to change because of that doctor's appointment or that testing that the doctor may order. So what do I mean by that is, you know, one of the things that neurologists will order is to have a yearly reevaluation of memory. And that involves doing some testing on computers. It might involve doing an MRI. And I've had caregivers that say, "I can't get my loved one to want to go to the doctor. I can't get them to go and cooperate in an MRI machine." And I have to say, well, what's it going to accomplish? Are they going to suddenly be able to cure them? No, there's no cure to dementia. You can't change the fact that they're progressing in dementia by doing an MRI. So stepping back and saying, we're not going to do those things. Because remember, I like to be the happy person. I like to be the person they want to be around. And that means not forcing people to go to the doctor all the time to try and get after some newest cure. That means thinking about, is that new drug, is that new treatment going to make a big difference in the longevity of their life? And even if it will extend life, what kind of life extension are you creating? So are you treating someone that's 95 that now has some type of cancer and you're not going to really cure them of it? Did you ask the doctor what the longevity is? Because a doctor's definition of cure is different than most of us lay people's definition. So that is something to think about. And It's something to think about, not only on how often you want to go to the doctor, but also what your focus is in your daily caregiving tasks. If your person has reached towards the end of their life, then letting them eat the things they want to eat is an okay thing. We're here to enjoy life. I had a geriatrician who's a doctor that works only with older people, and we shared a patient in common who all she wanted to drink was orange juice, and she wanted to either eat a cheeseburger or a grilled cheese sandwich. That was her entire diet. Oh, she did eat sugar items also. But so he and I talked about it one day, and I said, you know, do you have, I'm just going to tell you the truth. This is what she eats. I offer more, but this is all she wants. And he said, so what? Enjoy life. It's not going to change the overall length of her life by much. And we want people to be happy. So stop focusing on the food pyramid and focus instead on what makes people happy. Even if they're a diabetic, as long as they aren't a type 1 from childhood, you know, letting them have some of those sugar items, letting the focus be on enjoyment in life is, I think, the key. And I think that you'll find that your caregiving becomes so much easier when the person that you're giving care to is happy. And it makes a big difference when you're not constantly squabbling over all of the little things like what they want to eat, what they want to drink. Let them have what they want. Now, I will tell you that you can get back to manipulating the environment. If you do really want them to do something, think about how to make it. So one of my tricks, I want my people to sleep at night. My people still think they want to drink coffee, which is fine. I'm happy to let them drink coffee, but when they move in, they might have come moving in on caffeinated coffee, but I slowly move them into decaf coffee, and they don't know it. Over time, they don't know that it's gotten reduced because I make sure that they're still getting that same cream and that same sugar. They're still enjoying their cup of coffee, but we don't need them up at night. We need them to get good rest. So I manipulate the environment so that everyone can be happy. Give that a try the next time that you're thinking through how your day is going to go. Think about how you can make the reality be a happy reality for both you and your loved one, so that you can get breaks because they're not upset at you, and take those breaks. You know what? That I should have included as one of the things, because really that's number 4, is to take a break. Take time every day for yourself, because you will be a better caregiver. In my home, every afternoon is nap time. All of my residents either take a nap or they've got a couple of hours in the afternoon to rest and watch TV or do an activity that they enjoy. And I do something that I enjoy. Usually you'll find me behind my sewing machine making a new quilt, or I might be playing a game with my kids or with my husband. But that is a part of my daily rhythm, is taking time for myself. And I want you to enjoy your experience with your loved one. Get out there, enjoy your day, manipulate that environment. Subscribe to my channel if you want more hints on how to be a great caregiver. I am on a mission to help everyone enjoy their life again and to have the best care possible for your loved one, because that's probably going to be you helping them rather than some stranger that we don't know. I look forward to seeing you again in my next video. Be sure to subscribe and like this one, and check out my resources down below for the best caregiver hints.